introducing myself, Barb. Yeah, it's lovely to talk to you guys. Very difficult time at the moment because of COVID and the restrictions, but what a great way to use technology to link us in, and so you still get information on what people do for work. So it's a really difficult time at the moment, navigating this interesting world that we're in and what you might want to pursue into the future. So don't lose heart. Nursing's still a great area to be in. So I've been a nurse for 30 years now, and my journey isn't straightforward, but I always say that my career is a journey, and I'm probably nearing the twilight years now, so I'm sort of winding down, and would love more of you young ones to come along and sail the ship from here on. So yeah, it's a great time, anytime, to be in nursing. It's a great profession, and I'm very pleased that I've ended up being a nurse. I've never regretted it for a minute. So I live obviously in the area. I'm on a farm, a family farm, of which there's 2 families working together, and I choose to work off farm, obviously, and I work around about 4 days, 3 to 4 days a week. I don't work full time. I've never worked full time in my whole career. I work maximum a 9-day fortnight. Occasionally I might do 5 days, but a 9-day fortnight is sufficient in nursing, I believe, because the 10th day you work for the government, basically, so it's just a little bit of financial maths there. So yeah, I'd really love to answer any questions that you have. I could talk about it for hours with you, but I'm more than happy for you to throw whatever questions you have, and I'd really love you to explore sort of my pathways and what's involved. So by all means, just fire away and we'll have a bit of a chat for a while.
Who's first? Alice, don't be shy.
Okay. Was nursing something you always wanted to do, or did it just happen recent?
Yeah, so 30 years ago, Alice, I was, well, it's more than that, I was in what was called HSC back then, High School Certificate. And I can empathise with you people not knowing necessarily what you want to do. And I was no different back then. I really wasn't sure. I was extremely shy, sheltered, and had 3 older brothers. That was challenging. So in that they were doing all boy sort of stuff, and so I didn't know what girly career sort of stuff was sort of what was to look like. So I so happened to just be encouraged by my aunt, who was a nurse, and she just happened to say to Mum and Dad that she thought that Rose would probably make a really good nurse one day. And it's a great job, because probably back then they didn't really class it. I mean, they've always been a profession, but it was probably more of a job. And so Mum and Dad sort of just encouraged me to look at nursing. So I sort of fell into it, really. I wouldn't say I had a real passion at the time. I fell into it and developed a passion and found that I was in the right place.
Oh yeah. I'll just get the questions up again.
Yeah.
When you were in Year 12, how did you decide to study nursing?
Yeah, so we can expand a little bit further on that. I suppose when it came to Year 11 and 12, I sort of, we didn't have the breadth of subjects back then, but I sort of chose my subjects so as I could go somewhere in the health field. The only thing that we really required was English and biology and a basic maths, which is probably fairly similar these days, although you've got health and PE these days. So they were my main subjects, and then I put a chemistry with it and an accounting with it, I think, for my BCE, or HSC back then. And I don't know, did we have ATAR scores? We didn't have ATAR scores back in our day, did we?
No, we didn't. We got a did we got A, B's and C's and D's in my day.
Oh,
so we got grades for each subject, didn't we? And then
and you applied to the university, didn't we? We just applied to the university and crossed your fingers and got accepted. And the same thing required that you needed to have English. English has always been a standard that we've kept right through. So I found we had no health, we just had biology. Photosynthesis doesn't help much in people, but there was a lot of other things that do help. So yes, so it is different to what you're doing today, because you've got ATARs and sort of that whole ATAR scaling type thing. But again, there was a lot of competition for nursing. You know, a lot of girls went into nursing, so you know, you had to be a reasonable student to get there.
Yeah. Oh yeah.
Lizzie, do you want to ask a question? Sorry, I was just going to see if Lizzie wanted to ask one. Number 3, Lizzie.
What attributes do you think you need to do this type of work?
Yeah, so the attributes or the qualities that you have for nursing, or I believe that you need to go into nursing, is you very much need an interest in people. You need to be a people person. You need to be able to relate to people. And over time, you develop good communication skills, good communication with people. Now, in nursing, we just don't nurse necessarily one particular age group. So it's great, you know, if you've got a good rapport with children, and if you can communicate with adults across the board, with professionals, because you obviously have colleagues, and you've got doctors, and you've got specialists, and you've got students. So you've got to be able to communicate across your professional group. You've got to be able to communicate well with elderly. You've got to be able to communicate with people who have got mental health issues, acquired brain injuries, any number of particular conditions. And we also have to be mindful that we need to be able to be culturally sensitive and communicate with people who come from different cultures and things as well. So over time, you find that you do develop a wealth of information in communication and communication skills. That doesn't happen as you come out as an 18-year-old. That is something that you actually develop over the journey, I suppose. But as I said, when I was an 18-year-old, I was particularly shy. I was particularly sheltered. I hadn't been exposed to the world so much. I was very much just a little farm girl with a very, I suppose, just a basic upbringing. So, you know, over time and with experience, you develop those skills. You need to be empathetic, so that means that you need to have that caring type of nature to be able to you know, sense what's happening in a person's world, be able to put yourself in a person's shoes. You know, I don't know whether you guys watch, you know, there's the fantastic emergency program, the Royal Melbourne Hospital at the moment. Now, look at those doctors and those nurses. They are so, although they have such specialised skills, you watch their communication and their empathy, you know, the way how they actually relax a person in a traumatic situation it's really, really clever, but that comes with experience. So you need to be sensitive, you need to be caring, you need to be respectful of people. And we're all got an element of judgment to our side, you know, that's human nature. But you have to be mindful that, you know, these people, you know, they are unwell and they do need us at this point in time in their lives. So from a clinical perspective, you need to have a very much a problem-solving type attitude. Thankfully, we deal with people. People actually can communicate. Animals, I don't know how vets do it. That must be tricky because they don't communicate in English. They communicate other ways. Maybe vets can actually read that. But for us, at least people will communicate generally. If we're of the same nationality, we can understand each other. So it's really important to be able to use that as a means of problem solving. You need to be able to have an attention to detail, which is really important. One thing I'll bring to your attention, when I did my nurses training, in the 3rd year, we had to get 80% plus in everything in our subjects. And the rationale behind that was, in the event that you only get 80%, you understand that potentially 20% of your patients might die in your care. So ultimately what they were saying was, you need to strive to get 100% because you don't want that small percentage to be something that's so critical that could actually mean that a person becomes sicker rather than better in your care. So yeah, but that comes with experience, and with the studies that you do, you'll know you've got to have a love for the human body. It is wonderful, it is amazing, like you just do not realise, and what we take for granted with our body as to how it works. It is an incredible machine, but it's very much an area of interest, obviously, of mine, and obviously you develop quite a huge breadth of knowledge over time through your 3 years of studying. You also need to be an advocate. That's an area that we work alongside our clients. So in their time of need or vulnerability, we become the advocate for a client or a patient. We can become an advocate for their family, and also we can become an advocate for the community. So I work in community nursing, so I actually find myself at times being an advocate for the community as well. So when you finish your nursing, another attribute is to have stamina and endurance. You do some pretty long hours, and you do some pretty a lot of time on your feet, I suppose. So you need to be in good health yourself, and you need to look after yourself mentally and physically in nursing, because you do take things home with you. Invariably you'll be working in a team, and we have really good professional help around us these days to help us with our mental health. Very good access to counselling and things like that. So don't be deterred from that perspective, because you'll be very well supported. And the other thing is, you've got to remember, you've got to have a sense of humour. At the end of the day, you've just got to be able to have a laugh, and whatever that happens to be. Even in a crisis, you can still have a little laugh because you did something silly, or, you know, whatever it happens to be. A sense of humour can also be very therapeutic for a patient. It's as therapeutic as anything, is to have a little bit of a laugh and a giggle with a patient. So it just helps to relax. It's very healing at times. So yeah, it's not all serious. So you can have a lot of fun as well. So yeah, there's quite a list of attributes.
Yeah.
A lot of them you develop over time, I think.
Yeah.
In time.
Yeah.
You've all got them there. You've all got them. It's just a matter of the opportunity and the environment to develop them.
Yeah, yep, definitely. Rosie, I don't think there's a question on there about what you actually do in your role as a community nurse, and maybe
Yeah, sure.
Actually, I think it's question 10 if everyone's looking at the sheet, but I'm just interested because you've done nursing in a hospital.
I can tell you what I've done with my nursing if you'd like to know my journey.
Yeah, maybe a bit of a career path. That'd be great, thanks.
Yeah, that'd be great, because my journey is actually it's not extremely traditional, I suppose, but you may be able to relate to it, kids, because it'll give you some hope, I think, or some faith that you can get to an end. So I did my HSC, and I went off to university in Warrnambool. Now, the unique thing for me, for you to understand, is when I went into my nursing, nursing was transitioning from hospital training to college training, and I was in the very first intake of the college training or the university training, the very first intake it was Warrnambool Institute of Advanced Education, which is now Deakin University. So there was a lot in the media, there was a lot of resistance for nursing to going into the university. So there was this real backlash on how are these girls, how are these people, they're never going to make nurses, how can you learn out of a textbook, they're never going to learn, at uni. So obviously, that's the sort of sentiment that we were up against going into our nurses training. So I went in and I did my first and my second year of nursing training in Warrnambool. Halfway through second year, we were able to sit an exam, and what that did, that qualified us to become what they call an enrolled nurse, which is equivalent to your Division 2 nurses now today. Okay, your Div 2 with medication endorsement is what you've got today. So that's what I became. I then I went down with glandular fever towards the end of second year, and I deferred out of nursing. So I deferred, and I recovered from my glandular fever, and then Mum and Dad said, "Are you going to go back to your nursing?" And I said, "Oh, you're going to go back to study?" And I went, "Oh no, I'm not ready." It was hard for me too. I wasn't a scholar. I was a pretty average student, and doing nursing, although you guys do health and PE, so that gives you a good background. Biology didn't give me a good background into anatomy and the language that we were getting into in nursing. So I found it particularly difficult. I was only just scraping through. I was no blitzing student. So I said, no, I'm not keen to go back. And with that, I thought maybe I'll try and go off and be an enrolled nurse for a little while. So I ended up getting a job as an enrolled nurse at my local hospital at Hamilton, so Hamilton-based hospital. And I worked there for 12 months as an enrolled nurse, and that was fantastic. That was like a gap year. It was like I went in there and I learnt my basic nursing skills. I learnt the terminology of not only the nursing world, but I also learnt the pharmacology side of it as well. So I wasn't just put in an aged care setting with really basic nursing. I was put in the acute setting because the staff there knew that I'd come from uni and that I should go back to uni. And so they mentored me basically for that 12 months. I then went overseas and I travelled and I did that for another 12 months, came back, worked as an agency nurse then, which was fantastic experience again. As an enrolled nurse, I did agency nursing around Melbourne, where I went really from facility to facility, a lot of aged care, some acute, again, really just establishing my basic nursing care. And then I decided, radio, it's time to go back. So then I transitioned back to Deakin. It was now Deakin University. Back in Warrnambool I went, and I had to basically do total second year again. So I went back, started in second year, and completed my second and third year, and absolutely breezed through it. It was fantastic. Like it was so easy because I'd had that basic practical experience. So if you're an academic, if you're that way inclined, go straight through the uni. But for anyone who's questioning whether the ability to do that, I strongly encourage you to consider doing the TAFE pathway as well. You know, do that Div 2 training through TAFE, and then you might pop across to Div 1 into the uni. From there, I then I graduated. I did a fantastic graduate year, which was at Wimmera Base Hospital, and I did surgical, emergency, and dialysis. So that was a really good grad year, working in obviously a regional country hospital with size,
Sorry,
which I advocate.
Sorry, Rosie, I'm just going to interrupt. When you say a grad year, that just means your first year of after university, doesn't it?
Yep. Everybody, when you finish your Bachelor of Nursing, in nursing you go off and do what they call a graduate year, which is your first practical year.
Yeah.
And what that means is that you are mentored by staff within a hospital. So it's really valuable. And if you want to work in a country area, I say go to a country regional hospital. If you want to work in the city, because if you go to the city into Melbourne, you'll probably get put in an orthopaedic ward. And when you come to work out at Kerrang, we don't have many orthopaedics. So so it's not helpful. So if you want to, that's down the track though. You'd learn that later on. So I did my graduate year, and then I came up here and started working at Kahuna, which was fantastic. That was a great, as you know, it's a great little country hospital, and I worked there. While I was at Kahuna, I did theatre, emergency, I did dialysis, I did all acute and a little bit of aged care. And then I thought, I might go and do my midwifery. So back to study I went again, and I went back to La Trobe University in Bendigo, and I did my midwifery training. And with that, I practiced for, I practiced in Kerrang as a midwife, and then I popped into community nursing. I had a baby myself, and then I transitioned into community nursing with Kerrang District Health as a domiciliary midwife and district nurse. So I had all that acute experience behind me, and I was then able to develop an understanding and work out in the community as a district nurse and domiciliary midwife. A domiciliary midwife is somebody who gives postnatal care to a mother and baby at home. So that's the midwife. You go into hospital, have your baby, and then you go home, and a midwife will come and do a home visit and weigh the baby and an assessment on the baby and see how they're going with their feeding and things like that. So, and as well as district nursing, which is out in the community. So I've now been district nursing, community health nursing for 20 years, which is fantastic. It's an absolute little niche market. The analogy I give to it is basically not dissimilar to a GP. So a GP, if you can understand, is a doctor who has knowledge on a lot of different areas, a little bit of knowledge on a lot of different areas. And I'd equate myself as a community nurse is something very similar. Our day, we have a little bit of knowledge on a lot of areas. And then when we feel we need some expertise, then we refer on to other specialist nurses and stuff like that. So my day in district nursing can range from anything from dealing with a child who may need a vaccination to a person who may come in and they've injured themselves in an accident of some sort. It could be my little old lady or gentlemen's that I'm trying to support with their staying at home safely and well and independently, because ultimately that's what we want to do with our elderly, keep them at home for as long as possible, because that's where they want to be. So we offer services in monitoring their health and then referring on to services as what's going to support them. Do they need somebody to help with their housework? Do they need Meals on Wheels? Do they need somebody to do their garden? And those sorts of things. We help navigate and actually coordinate those services as well. We also work with specialists, you know, people who come home out of hospital. They may have had cancer and they've had chemotherapy. We need to maintain a dressing, or we might have to give chemo, or we might have to change the chemo. We might have to do things like that. So we're working with the oncology specialist field, say from Bendigo or Peter Mac. Yeah, so it's a very varied role. Case management, acute clinical skills, as well as advocacy, and then also working with families. You know, a lot of people have families away, so we need to liaise with the families and keep them in the loop with what's happening with their family members at home as well. So it's a really, really interesting area. It's a great area. In Pyramid Hill, I'm actually working, we only work as one nurse, so we are actually in an autonomous role, which we need to be very, oh, well, we've got to be grateful for that. I mean, we're trusted by our employer, we're entrusted by our community, and we basically, you're still part of a bigger team, like Northern District Community Health. We've got, you know, 50 odd other clinicians around. And I've got at least 10 other nurses that I can call on. Although they're not in Pyramid Hill, I can actually access them, you know, for support if I need. So yeah, it's great from that perspective that you can work alone. Yeah, and sometimes I won't sugarcoat it. Sometimes it is scary. Like, you know, if you are confronted with somebody that's having a crushing heart attack, it is scary. You do cross your fingers and your toes and you take a deep breath and you say, I'm here for you, we'll get you through this, and you do your best. And that's all you can do. You can just do your best. Mm.
Have we got anybody else in there who's happy to ask a question? That was a great description, Rosie. Really, really good. It makes it all come alive and seem very real, doesn't it, kids? I'm just amazed at how much knowledge, like when you describe it as being similar to a GP, the knowledge that you must have to have about pharmacology, about, you know, the body, the way the body reacts to certain drugs, you know, all that sort of stuff.
Yeah.
And that's always changing.
Yeah.
So you've always got to be up to date with all those all that knowledge. It's huge.
Yeah. It is a changing field all the time, but we are very lucky to have great resources to access to, and I never ever for a moment think that it's all up here. Like, it's more, the skill is being able to actually access the information appropriately. So it's more than actually, you know, and these guys are doing the same, you know, with their studies. It's not so much, you do need to have a level of knowledge up here, but the real savvies is knowing where to access that specific knowledge for your learning. And you go, oh, hang on, actually, I just can't remember on that particular drug. I'll just get onto the web, you know, onto my MIMS, which is sort of our professional pharmacology unit, that we get online, and I go bang, 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 and we go together. We actually learn about what's going on and what that drug and stuff's about. And these kids are all over that sort of thing.
Yeah, and you would always be able to refer to the doctor. Like, the doctor will always be there to refer to, and the team of people who you work with as well. So
Absolutely, they are fantastic. The doctors are very much a great resource, and we very much work as a team together. And I say that honestly, like that's just not my Northern District Community Health team of medicos. That's around the whole region really. We, you know, over time you build a rapport, and they know, you know, we ring for a reason.
Yep, terrific. Sammy, are you there? Do you have any questions?
Yeah.
Do you have any questions that you'd like to ask? Something from the list?
How has COVID-19 like impacted nurses today?
Oh, Sammy, that's a ripper. Oh, Sammy, my big punchline to that one is the only constant is change. So every day is different. At the guidelines and everything are changing. However, how it looks for us in community at the moment, I'll focus on community at the moment. So going into ISO 2, where with our clients, in Pyramid Hill, we probably have a stable clientele that we see regularly of about 30 patients. And at the moment, we are only seeing what we call our category 1s. Now, when I say seeing, I mean we're having face-to-face contact with these people. And whether that be at the clinic or whether it be we do a home visit. Now, those people are people who may have a wound, say, on their leg that they need to have dressed. Well, with COVID, we cannot not dress it. Like if we don't dress it, that wound will deteriorate and that leg will be very sick. So it's our duty of care to continue that care. We're seeing people who need assistance with their medication, and that can be a person who has dementia and they simply do not have the capacity to be able to find the Webster pack. They might find the Webster pack, but they might take the nighttime pills which are on the wrong day. So we need to be able to support and to be able to supervise them in taking their medication safely. So that's a really important thing. And anyone who happens to be what we call palliative care, if they happen to be unwell at end of life, we will be supporting them. And anyone with chemotherapy requirements or something like that, we see them. They're category 1, so we must do home visits with them. Now, the way that looks at the moment is that we are wearing gloves, mask and goggles on a home visit. We ask the 4 questions. Are you well? Do you have a sore throat? And have you, well, we're not saying travelled overseas because predominantly our clients won't have travelled overseas. I do ask, have they been to Melbourne though? Because quite a few of our people do travel to Melbourne for medical appointments. So I will say, have you been to Melbourne? If they've been, if somebody or they've been to Melbourne, then that gets tricky. I just go, do you feel, and I take their temperature and I get a bit more information about where they were, what they were doing, what their movements were, as to whether, before I actually go in and give them care. So, so with that, and then you come out and we take all our mask and everything off, dispose of that, do our sanitizer, hop back in the car and off we go. So really important, you know, our sanitizing and our personal protection is really important in this time. Thankfully, we are living in an area with minimal, you know, very low, you know, we've only had 1 case in Gunnawarra and 3 to 6 anyway in Loddon. So we're still very low, low numbers, but we cannot let our guard down because this virus is really, really, really infectious. So yeah, it's really, really scary, but we'll just got to hope that our 6 weeks of isolation and the lockdown of Melbourne is going to have an impact. If it doesn't, well, we're going to be here in this space for a while and we have to get used to our pretty masks.
And our Zooming.
And our Zooming, yes.
Yeah.
How good is this Zoom? I love it.
Yeah, it's terrific. Does that answer your question,
But I
Sammy?
would never have, Sammy, I would never have thought I would have been, I never in my whole world would I have thought I'd be dealing with something like this in the Western world, you know?
Yeah.
You hear of these sorts of things in the third world, don't you? You hear of all these things, but, you know, who would have thought that we're you know, going to be confronted like this? So another thing with regards to COVID is that we've got our names down as backup. So in the event that Bendigo gets exhausted, for instance, we could well be called in to go and help. So whether that be in community or we're in an aged care or something like that. But at the moment, we're just sitting there on a list at the moment. So, but also we don't have a lot of nurses here locally. So we'd love to see you 6 go off to nursing. It'd be great. Come on back. I'm ready for the next generation.
Perhaps we better fast track them, Rosie. You know, just do a 6-week crash course or something.
Sorry, Barb. No.
Maybe 6 months.
No.
Not enough.
Nope.
Hey, Jana, I see you're on board. Have you got a question there on the list that you'd like to ask Rosie?
Question number 8. What was good about the course?
Yeah. Thanks, Jana. I think what was really good about the course was that I particularly enjoyed the anatomy and physiology side of things. So the pathophysiology I really enjoyed. So that's learning how the systems work, I suppose. So you look at the cardiac system, how does that work? And one that I really didn't really master until I was out of nursing and ended up, and I purposely went in and did dialysis so I could learn about the renal system. I found that particularly difficult, that filtration system of the kidney and the electrolytes and all with the creatinins and all that. How did that all work? Well, I never got it as a student, but when I went off and did dialysis, well, that put it all together for me. So I particularly like that. I'd like to say, like, the clinical placements were fantastic in that you were able to embed your knowledge and learn off those nurses. You just learn so much from, I was probably a bit more of a visual learner, so I learnt very well on the job when I was out in the clinical field. And if I can have any advice to you, is don't be afraid to ask questions. Always ask questions. You can never ask a silly question. You can never ask too many questions. We're sitting there waiting for you to come along with fresh eyes and challenge us too. You know, by all means, you know, we're happy to be have a robust discussion around various practices and techniques and stuff like that. So yeah, so that was enjoyable. Jana, just being mindful, I'm not sure if you were in there and listened to my blurb, but I started my nursing, I was the first of the college nurses or the university trained nurses. So I could still say that probably my clinical placements, although I did enjoy them, they were challenging because we were up against the hospital nurses who were very much resistant of us as nurses. So they were very much, you know, they were very, oh, you wouldn't know how to do that, or, you know, this is how you do it. You know, you can't learn this out of a textbook, you know, and things like that. So there was a lot of language that was very negative. So we had, you know, there was a lot of psychological sort of stuff going on that was challenging. I didn't particularly enjoy sociology. I didn't particularly enjoy psychology either. And I don't particularly enjoy mental health. I will be honest with that. I do find mental health particularly challenging. However, I do support people with mental health and all that sort of thing. But that's just a thing. I just find it challenging.
Yep. Who'd like to be next? Blake? You there, Blake? Sorry.
Question.
Can't hear you, Blake.
So, what role is it?
Which one are
How
you?
has it affected your life?
Sorry, Blake, I think I spoke over you then. Could you say that again, please?
How has it affected your life in a general sense?
What was that, Barb?
How
Blake?
has it affected your, I missed the last word, Blake.
Just your life, I guess.
Aha.
Oh,
So how has nursing affected your life generally? Is that what you mean,
Yeah.
Blake? Just generally? Yep,
Yeah.
good question.
Yeah. Good question, yeah. So I guess it's interesting that you say that, Blake, because I was just reflecting on it recently when I was thinking about my final chapter of nursing, and also last year I was asked to write a reflection on my nursing, and I couldn't help but think that it becomes part of your being. You know, it's a bit of it becomes part of your identity once you've been in the same profession for such a long time. And I have trouble finding what my other hobbies are, because I've always just been a nurse. I've always been nursing, and if I'm not nursing, I'm with family, sort of thing. So it's really has been a major part of my life, clearly, you know, because it has become part of my being, and I love that. You know, that's great. You know, I don't know, people probably see Rosie Bear and, oh, Rosie Bear's a nurse, you know. So it's been wonderful for me. It does have pressure with it, though. You know, you will get some calls. You get calls from neighbours and community. And I was in Port Fairy last weekend, and I got a call. But that's okay. You know, that's nice that people can feel that they can access your knowledge or get reassurance or whatever their need may be, that they trust you. Yeah, I'm very grateful for becoming a nurse and still to be nursing these days too. So it's a positive, Blake. I would say it's been a good thing.
It's always been a very valued and highly respected profession. I think it's fair to say. Don't you think, Rosie?
Yes, it is. Very much so, Barb. It still is today. I think there's statistics that come out on that, isn't there, as to the most respected professions. And I think nursing is still up in the top 3 anyway.
And especially since this pandemic as well.
Well, I think that's particularly put teachers and nurses right up there. I think for sure. And that, you know, being right on the cold front of Melbourne, you know, or, you know, wherever the hot spots are and everything, you know, that must be so challenging for people, you know, really difficult for the medical teams and the nurses. Because invariably, you know, the doctors are in the background, the nurses are doing the groundwork. Like in our case in Kerrang, up there, the doctors are doing the pathology slips, and they're doing the reporting back of the results. But who's in the front line?
Yeah,
it's the nurses. We're the nurses. We, the nurses, are the ones who are actually, we're at the window of the car and we're doing the swabbing. You know.
Yeah.
That's just the way it works. You know.
Yeah.
That's
right.
That's the way. That's what we are. And I think I love that part of it. I love the fact that we are so hands-on and we are very much working within community with our clients, walking beside them with them. Yeah. Yeah. That's just what we do. Yeah.
Yep. It's incredibly selfless in lots of ways. A very selfless profession.
Yeah, very much so. Yeah,
Mm.
yeah.
Peter, I know you've been dropping in and out a bit.
Yeah, I have. I
Yeah.
don't know what's going on there. I just keep dropping in and out, in and out, in and out, and it's annoying me.
Oh dear. Have you got any questions for Rosie, or have you got any comments about anything that Rosie's been saying?
Well, I'm pretty sure I've missed a lot of it due to the fact I
Oh.
keep dropping out. I'm not sure, to be honest.
So, have you ever been interested in nursing, Peter?
Oh, there was one point back when I was younger.
Yep.
And then I just got interested in other stuff. Yeah.
Yep.
I guess with nursing, I suppose back when I started nursing, it was still very much a female-dominated profession.
Mm.
And in my 30 years, I've seen an enormous growth of males coming into nursing, which has been great because guys, guys in a team are a great leveler, let me tell you that. Quite often when I first started nursing, there was a lot of teams of girls, and you know what a lot of girls together are like? It can be challenging. It can be very challenging, and males are a great leveler. So it used to be the doctors back in the day, but now we've got male nurses and a lot of male nurses who make extremely good nurses. And when I was doing my mid, I came across a few, I wouldn't say quite a few, but I came across a few really, really, really good and special midwives. So male midwives, and they were fabulous. It's just like a calling to them, I'd have to say. Like it's just something special. And same in you know, emergency with the male nurses and aged care. You get them everywhere now, the male nurses, and they really are, and it's great. There's no you know, there's no segregation. You know, you're a nurse, doesn't matter. You know, you're male, you're female, you're just part of the team now. So that's been an absolute positive to the profession. It's been great. Yeah.
Great. Lizzie, just before we finish, Lizzie's been doing a work placement at Port District Health, Rosie.
Oh, fantastic, Lizzie.
Yeah. Do you want to tell Rosie a little bit about that, Lizzie? What you've been doing there so far?
I don't know. I don't even know what to say. I don't know. Just follow people around.
Yeah.
So you've been at the hospital there in Bort for, you've only been there about 4 times now, Lizzie, would it be? 4 Mondays?
I think 3.
3, okay. So, and you're working in the acute ward, do they call it? What are the wards called at Bort District Health?
I don't know. There's like.
What are the different areas of the hospital?
And I don't know. I only know the acute one, and like I don't know what the other one is.
Yeah. No, that's all right, Lizzie. I can relate to that because I did my work experience at Hamilton Base Hospital with a dietitian actually at the time, and so I got to know the kitchen well and the processes there, and then I learnt and had some time with the dietitian who was also doing her consulting work, but then we also walked around the wards. And we were doing, obviously, menu planning and things like that with various patients in the wards. So that was a great way to actually get a look at the hospital. Now, I came away from that thinking not really interested in dietetics as such, but it gave me a feel of what a hospital environment's like. Yeah. So Lizzie, although you happen to be there at Bort, and I don't know whether it's in a general sense or whether you're sort of following nurses around, it is a great way to actually just have a look at and open your eyes as to, and take that. I think there's a little bit of fear. I know I had a little bit of fear around a hospital. I thought it was a bit scary. So to go and work experience it's a great way to go and follow people around and look at who's part of the team. You know, in the Bort Hospital, you've got the kitchen staff, you've got a doctor, you've got a team of nurses, and you've got activities people, you've got visiting physio, you have speech pathologists, you have dietitians, all come to that facility. So it's a great place to just stop and observe, ask questions. Even if you're not particularly interested in a particular field, it is a really good area to get a little bit of a taste of what goes on in that health facility. So yeah.
Terrific.
Are you feeling as though, Lizzie, anything sort of resonates with you at the moment? Lizzie, is there anything that sort of lights your fires?
I have no idea.
That's all right.
But I think you are enjoying it though, Lizzie, aren't you, so far?
Yeah, I am.
Yeah, she is. She is. And 3 days is not very much.
No.
And it's just a real shame this year that those work placements have been put on hold now until probably term 4. So yeah, it's really bad luck because we were just getting into it and then it all closed up again. But I think we've got to the end of our list, Rosie, unless anyone else has got anything else to say. No, I think that's good.
Yeah. Did anyone want to talk about I was just thinking as far as from a professional point of view, does everybody know whether we're poorly paid or we're well paid? Are you sort of interested in that side of things and we're not talking about it?
We didn't include that on the list.
Would you like to know about the pay side of things?
Or the conditions?
Yep. So do you want to know about that? Do you want me to rabbit on about that for another couple of minutes? Or will I anyway, Barb?
I think that's Lizzie. I think Lizzie came on there for a minute. The frog. Is it the frog?
Okay. Okay, Lizzie.
So I think that was a yes from Lizzie.
Yeah.
Yeah. Alrighty. Okay. Well, I'll do a little bit around this side of things. Well, for starters, I'll go back a step. I'll go back to as a profession, as a nursing profession, we actually have a union who support us. It's important that you know that because we do get ourselves in tricky situations from time to time, and part of your nurses training is doing a very big component on legal side of things. So, but at the end of the day, if you work within your scope of practice and you do your duty of care, you'll have a swimmingly good career. I've never been to court yet. Fingers crossed. I've done lots of reports. I've done lots of reports for coroners, but I actually haven't been to court, and I'm still practicing. So, yippee, after 30 years. So we've got a union that's called the Australian Nurses Federation. It is a national union, and basically they are there to support us in our time of need legally, and whether that be to do with some of your clinical practice or if it's to do with our conditions. So it's working with you'll hear from time to time that the nurses are out there with their red t-shirts and their banners, and they are fighting for an award change or a pay rise or whatever, what's it called, an EBA agreement and things like that. So it is really good to have a union who are supporting us professionally. All right, so we do have a really good award wage. We're very much, there's a very big scale of an award wages, of which you go up in time with regards to your experience and your level of knowledge as well as your years of experience. So when you come out as a graduate nurse, you come in as a grade 2, grade 1 or 2, and then, no, you come out as a grade 1, and then your second year you go into as a grade 2, and then you have grade 2 up to the years of 8, and then it gets into specialty sort of fields and that sort of thing. So, and you go all the way up to a grade 5 and 6, which is where you are a Director of Clinical Services, which is equivalent to what we used to know as the matron or the Director of Nursing. So they're at the top of the field of the nursing tree. So your average acute nurse at Bendigo Health is, just a ward nurse as such, is a grade 2 level, and then when you go and become in charge of a ward on a shift, you become a grade 3 level, and then when you become in a specialist field, you become a grade 4 level, and then when you become in charge of a whole team like Kerrang District Health, in charge of all the nurses there, which is a big team, you become like the Director of Nursing as a grade 5 level, and that's graded according to how many beds the hospital has. So for obvious reasons, the Director of Nursing or the Clinical Services at the Royal Melbourne Hospital is going to get paid a lot more than somebody who's a Director of Clinical Nursing in Kerrang, because we only have a 30 bed opposed to hundreds of beds at the Royal Melbourne. All right, so that's sort of the level of the pay structure. It is very well paid as a profession. You will hear that people are not well paid. Nursing is well paid, I believe. That's my personal opinion. It is very well paid. The other thing is you do get paid base wages from 7 o'clock to 3 o'clock that day shift, and then you get your penalties. So if you work an afternoon shift and you get paid penalties for that evening because you're working in your evening time, and likewise with night shift you get paid because you're working while people are sleeping. So you should be remunerated accordingly because you're awake while everyone else is asleep. Mind you, you work night shift for 20 years, it will decrease statistically, it decreases your lifespan. Keep that in mind. The other thing is weekend work. Weekend work, you will get penalties. So if you're on $30 an hour, you will get, you'll get another 25% per hour on that. So you can work, you become very savvy over time, and you will say that I only work in time when you've got experience. You'll say I only work weekends or I work evenings because you're paying your mortgage off and you want to get that paid out, or your credit card, you want to get that quid off because you've had a bit of a holiday or whatever. You can work it to your advantage too. So you can do really well out of nursing in that respect. From my perspective, I'm in community health. I'd sort of done all that shift work and all that sort of thing. I've been over that with a young family and moved into community, which means I only work Monday to Friday. Wherever I go, my service in Northern District Community Health, it's only Monday to Friday, and we don't only work daylight hours. So I only work from 8:30 till 5. There's no after hours sort of work. So I'm on a sort of a base wage. I don't get any penalties other than public holidays. You will get paid public holidays. You get penalties, what we call penalties to work Christmas Day, any public holidays. You'll be remunerated. A public holiday comes along for me. I work Monday to Friday because we're part of an award and a profession. The public holidays on a Monday, I get paid regardless. I don't work any public holidays. Our service is closed. I get paid that regardless. That's just the way how the award works. And yeah, I don't work weekends, so therefore I don't get paid. But out in community, we're considered a specialist field, so we get well paid. Yeah. So I just thought it's important that going into any of that sort of area, that it really is. It's a great profession to be thinking about from that perspective as well. Yeah, it's very secure. You'll be well looked after. And you are well remunerated. You do have to work long out, you can choose, you will have some times when you first start out. We all start out and work. As I say, I never worked a full 10-day. I mean, I might have done 9 days in a row, but I never did a full-time 10 days sort of in a row or anything like that. But then you know, who knows what your journey may be. It's many and varied ways of doing nursing. It's just a journey. There's so many different avenues you can go into. So many different avenues. And nursing can be used in a lot of other. I'd just say this, Barb. I did have a little period outside of nursing too. So I went and did case management, which is where you go and do support service coordination, and I did that with Bendigo Health in Gunnawara Shire, where I worked with fairly complex people who had acquired brain injuries, aged care, community aged care packages and things like that. Nursing was such a great platform to be able to utilise in that area. Although I wasn't clinically nursing, that knowledge was invaluable. So the basic nursing knowledge you can take, and you will find that it'll, in the health field, it'll be really valuable to you.
Yep. Yeah, I think we all know people who have done nursing and then are doing something completely different, but that nursing has given them a really good grounding in how to communicate with people, how to relate to people, how to organise your time, how to work efficiently, and it's just a terrific profession to have under your belt, I think.
Yeah,
and it can lead to all sorts of other things. Yeah. Thank you, Rosie. I think we're good. I think everybody's just about talked out, unless we've got some more questions. I think we can say thanks very much, Rosie. And would someone like to thank Rosie on behalf of the students? Who's going to volunteer? Alice?
Well, thank you for coming and talking to us, I guess, or like virtually coming and talking to us. It was very informative, and I think all of us appreciate it.
Great, thanks so much, Alice, and thanks for the group coming along and listening. And know that any time you're more than welcome to come along and have a look at what I do for you people that are in Pyramid, subject to COVID, obviously, but hopefully we'll get back to some normality. And you're always welcome to come and have a look, and I'll continue on there for a little while yet.
I know there's been quite a few students from Pyramid who have done work experience at Northern District.
Yes.
So so that might be an opportunity that the Year 9s might look into doing next year. It may not happen this year for the Year 10s, but hopefully next year there might be a couple of people who are listening who might be interested in coming and doing just 4 or 5 days work with Northern District, where they could spend a day with you, a day with the speech pathologist, a day with the occupational therapist or the dietitian or whatever. So, and I know Northern District do that very well.
Yeah, Northern District, we do enjoy having students come through. So, and that's exactly, it's a great way to get a look at allied health across the board. It's a fantastic facility, and we just love having the students come with us. Like I love having a student coming with me and hopping in the car and off we go, and we go and see what the day presents. Yeah, no, it's really good. A lot of fun.
Terrific. Thank you very much, Rosie. We'll say goodbye, and we'll catch up with you soon.
It's a pleasure. Thank you so much.
We will be in touch.
Lovely. Take care. Good luck with everything, guys.
Yep, you too, Rosie.
Bye. Enjoy homeschooling.
Have a good weekend.
Bye-bye.
Thank you.
Thank you. Yes, have a good weekend, everyone.
Yep.